prominent pulsation visible. I here, just here, can see pulsation. Okay, in epigastric or upper sternal part, jugular, yeah, no pulsation. Epigastrium, do you see?
No.
Yes, it's present. Yeah, here is present epigastric pulsation. Okay, in the area of apical impulse.
Can't see.
No, not so clear, not prominent pulsation visible. Okay, так. Then you have task visual examination and palpation of pulsation in the neck and chest on your practical skills. Then examination of apical impulse. Yeah, apical impulse we can review in 70% of people. Yeah, if it occurs between intercostal spaces, we can see, we can palpate it. If it's located touch rib, yeah, we cannot palpate it. Okay. Now let's try to determine. Yeah, if you don't find, we will take another model. Okay, to train this apical impulse. Okay, how to determine apical impulse? First we look. Yeah. Sometimes if it's visible, you just place your fingers and that's all. Palpate, analyze it. If it's not so clear visible, here it's not so clear. Yeah. What should we do? Yes, we need 4th, 5th, 6th intercostal spaces and our 3 fingers. Okay. 2nd, 3rd, 4th, 5th, 6th. Okay. One more time. 2nd, 3rd, 4th, 5th, 6th. Okay. And place fingers. Okay. Then I shift my fingers to palpate it. Okay. No, and here it's palpable. Slightly, from time to time it disappears because on inhalation, breathing or exhalation, heart moves up and down and touch intercostal space. Okay. Так, it's here. And now we should analyze its characteristics. What characteristics of apical impulse? Location, let's calculate. 2nd, 3rd, 4th, 5th. 5th intercostal spaces, how many centimeters?
It's a 1 to 2.
Okay, here is approximately 1.5 centimeters immediately from mid-clavicular line. Does it correspond to normal? Yes. Then the next characteristic.
It's amplitude.
Amplitude. Okay. Amplitude, if it's less than 1 millimeter or more than 5 millimeter, it will be abnormal. Here is moderate amplitude. Okay. Then we analyze diameter. Okay, what is diameter? What is normal diameter?
Less than 2 centimeters.
Less than 2, yeah? Is the tip of your fingers?
It's
Yeah?
1 centimeter.
No, here is approximately 1.5 maybe centimeters. Okay. Then force. Okay. Force. What should be force? Should be moderate. Moderate. Okay. Amplitude. It's a height on which this apex elevates in system. Okay. If it's too tall, more than 5 millimeters, we consider that it's pathological due to severe hypertrophy. If it's less than 1 millimeter, it means very, very small amplitude. It will be in weak myocardium or in very thick intercostal spaces due to fat, due to muscles. Yeah. No, and moderate, it's usually from 1 to 5 millimeters. Okay. Force, it's a force which of touch of the apical impulse to your finger, and resistance is a structure of myocardium. It should be moderate in healthy person. Okay. Так. If patient, now look here. If patient has large diameter of apical impulse, why can it be? Yeah, large left ventricle. Okay. If it's shifted to the left, why can it be? No, can be increase position of diaphragm. Yeah, what else can be? enlargement of chambers of heart, shift left ventricle shifted to the left. Okay, it can be if person turn on his left side in bed, yeah, it will be shifted to the left too. Okay, if amplitude is very tall, why can amplitude hypertrophy, yeah, increased thickness of myocardium. Okay, yeah, in left ventricle hypertrophy, for example, in arterial hypertension. If amplitude is very small, it can be in heart failure, in systolic heart failure. For example, if patient has myocarditis, dilatation cardiomyopathy, okay, very weak myocardium, okay. No, and force and resistance, yeah, if it's increased, if it's very solid muscle, it can be due to hypertrophy and hypertension. And if it's very weak and soft, it can be again in heart failure, systolic heart failure, dilatation cardiomyopathy, and ischemic cardiomyopathy, and so on. Okay, is it clear? Now you have 5 minutes. You can check apical impulse on him or take some more student, okay, compare them. Your task is to find 2 apical impulse and then analyze it. If you don't find apical impulse in normal palpation, what can we ask patient to do? Bend and exhale, yeah, and exhale, yeah, and then palpate. Okay, you can do that. Так, what else can we check with palpation? Yeah, we can place our hand here, yeah, and right ventricle pulsation impulse we can feel too. We will see severe enlargement which touch your fingers not only in area of apical impulse but in all this area. Okay. Так, and trills. What is trills?
Tactile primitus.
But person does not speak. When the patient has severe murmurs in his heart, this vibration of turbulent blood flow will spread on chest. That is why we can find systolic and diastolic trills. Systolic trills we can find in second intercostal space in aortic stenosis. Okay. Diastolic trills we will find in fifth intercostal space in mitral stenosis. Okay. Why we consider that this is diastolic trill? If it be an apex, it does not fuse with apical impulse, because apical impulse occur in systole. Between apical impulses, when we feel this vibration trills, it will be diastolic trills. Okay? Так, 5 minutes for you for training and then continue with borders.